Hello, everyone. I'm Professor Nancy Baxter, head of the Melbourne School of Population and Global Health. I'm coming to you today from Melbourne, which is the lands of the Wurundjeri people who have been custodians of this area of Australia for thousands of years and many, many generations. I pay respect to their elders, past and present, and look forward to our shared future together. So welcome everyone today. We will be talking today about the statistics for the past several weeks, and then be focusing on Omicron and the potential threat that we face from the Omicron variant and what we can do to protect ourselves from it. So could we start with the slide deck? So first, there have been over 23,000 COVID cases reported in the community over the past 2 weeks. And as we can see, we continue to have a predominance of young people being diagnosed with COVID, with 6,518 being diagnosed under the age of 20, and over 50% of cases are 30 years of age or lower. Next slide. This shows the growth of the outbreak. So it's the doubling time. So as the lines go upwards, it means it's taking longer for the virus, the number of cases to double. So that's a good thing. It means the outbreak is slowing. And as you can see, ACT and Victoria continue to have lines that are going up towards the right-hand corner. And also outbreaks in Northern Territories and South Australia also seem to be diminishing in size. The concern here is in New South Wales, where the line, which had been fairly straight, going towards the upper right-hand corner, is now turning, meaning that the outbreak is in contrast to the past few weeks, is starting to increase in terms of its doubling size. So that's concerning, meaning that the outbreak is growing, and we're seeing that in increasing case numbers in New South Wales. Next slide. There have been a lot of questions about the outbreak and the cases requiring hospitalization with Omicron in South Africa. So we thought it would be useful to track the outbreaks that we've had in Australia, to look at the length of time between when case numbers peaked and when hospitalization peaked. So the top two graphs show the two waves in New South Wales, the first with the wild type variant, COVID 1.0, and the second with the Delta variant, and then the three outbreaks in Victoria in the lower part of the slide. And what you can see is in all of the outbreaks, there was a substantial lag between the darkest line, which is the number of cases and hospitalizations, which is in gold in all of these, between at least a 8-day lag and up to a 14-day lag between the peak of cases and the peak of hospitalizations, meaning that given we have only now started to see large numbers of Omicron cases, that it will be some time before we actually know how many hospitalizations result from that. And in general, the lag between case peaks and ICU peaks is even longer. Next slide. So in terms of what we know about Omicron currently in Australia, there have been 73 cases of Omicron reported in Australia, and there's known community transmission that's occurred in New South Wales, and it's suspected in both Victoria and South Australia. So extremely concerning that this variant is starting to take root in Australia. It's really important also to note that this variant does lead to increase in breakthrough infections. A number of outbreaks in multiple countries have been in fully vaccinated and even boosted individuals. And these seem to be infecting large numbers of individuals at single settings, so i.e. super spreading events, even amongst the highly vaccinated. Next slide. Fortunately, our vaccine rates in Australia are very, very good. When we look at the percentage of the population over 16 vaccinated, we can see for first dose, it's over 93%. For both doses, it's 89% of the eligible 16 and over population. It is lower when you look at the 12 to 15 group. So in that case, we have 77% of all 12 to 15-year-olds vaccinated and about 70% with 2 vaccines. Remember, this is of the eligible population, so it doesn't reflect the entire population. Next slide. In terms of outbreaks in high-risk settings, we know that there are 36 active outbreaks in aged care facilities across Australia. And over the past 2 weeks, 173 new resident cases have been reported, 84 new staff cases, and 20 new deaths in aged care. In school outbreaks, there have been a large number of school outbreaks. 35.1% or 6,518 cases have been in children below 18 in the past 2 weeks. And many of these have occurred with school transmissions. We know there have been 702 COVID incursions in New South Wales schools in term 4 and counting. So there will be even more. So a high number of schools that have been affected by COVID-19. Next slide. In terms of hospitalizations and death, there have been a total of 534 people hospitalized in Australia for COVID-19. And we have seen 99 patients sent to the ICU and 44 on ventilators. It's important to note that in Victoria, the number of patients in ICU is actually on the increase. Next slide. So with that, we are going to have Ben Virulence speak about Omicron, the risks of Omicron, and what we can do to help prevent Omicron from spreading and causing serious illness and death in Australia. Over to you, Ben.
Thanks very much, Nancy. The Omicron variant is a new variant of concern that's concerning OzSAGE significantly, particularly in light of the latest data from the UK Health Security Agency. I'll just share now a copy of what's called a risk assessment that's been produced by the UK Health Security Agency, and this is from 4 days ago. It's dated the 9th of December. There's also an accompanying report dated the 10th of December, which is linked to in the latest OzSAGE statement on the Omicron variant, which is now available on our website. The key points from the UK Health Security Agency's report of 10th of December included that studies of households and contacts found a higher risk of transmission to contacts from an Omicron index case when compared to a Delta index case. Overall, they found that there was a growth advantage for Omicron over Delta, and that could be due to one or two of the following reasons. One is that it could be due to immune evasion, which means that Omicron is infecting people because the vaccines that they've had have not been sufficient to provide protection against this new variant of concern, or because their previous infection with another strain of COVID-19, such as the Delta variant, isn't sufficient to protect them. The other possibility is that it's more transmissible. And of course, it could be both of those. We don't currently know, but we do know that that growth advantage means that this Omicron variant is highly likely to predominate over Delta in 2022. And the UK's assessment is that the number of cases may reach parity between Omicron and Delta by as early as the middle of this month. The UK have also reported that there is no epidemiological data as yet to definitively assess the severity of Omicron compared to Delta. What that means is that it's too early to say whether or not Omicron causes a more mild form of illness compared to Delta, or a more severe or a similar form of illness. It's simply too early, but data should be in over the coming weeks that will help to answer that question. In the meantime, we should assume that it is at least as severe as Delta and act accordingly with the same types of precautions as OzSAGE has been recommending for the control of COVID-19 as an airborne virus in general. And thirdly, the UK data has shown that based on neutralization data from multiple laboratories and a preliminary assessment of the real-world vaccine effectiveness in the UK, Omicron is displaying a reduction in immune protection against infection. That means that there's very low levels of protection being seen after 2 doses of either the AstraZeneca or Pfizer vaccines, but there is an improvement in the response after a booster dose. For that reason, OzSAGE believes that boosters confer a significant benefit, raising protective antibody levels, and should be encouraged with a sense of urgency by the Australian government. On the point of vaccinations, we note that as of data published by the Commonwealth Department of Health yesterday, 19,262,415 Australians were double vaccinated, which equates to 75% of the entire Australian population. So that means there's still 1 in 4 Australians who remain not at least double vaccinated. And in terms of how many people are already triple vaccinated, well, that's only 687,067 people, which is merely 2.7% of the total Australian population. So clearly, if boosters are an important defence against the Omicron variant, Australia has a lot of ground to catch up on very quickly. We've reiterated a number of our previous recommendations in response to Omicron. Given that we know SARS-CoV-2, the virus that causes COVID-19 disease, transmits by the airborne route, most of these recommendations are centred around airborne protections. The exception, of course, is boosters. However, we've previously recommended those on the basis of data showing declining levels of immunity over time, even against ancestral strains such as the Delta variant. The airborne protections in particular that OzSAGE are recommending include optimising use of outdoor spaces. This is particularly important coming into the holiday season, so planning to do as many things outdoors rather than indoors as possible is a really good way to reduce risk of transmission. If you do have to be indoors, trying to limit the number of people who are present, the duration of time you're in that space, the number of people who are not wearing masks, and obviously improving ventilation through any means necessary, such as opening windows or doors, or potentially installing portable HEPA air purifiers. For building managers, there are opportunities to upgrade the HVAC system to improve an increased level of fresh airflow into the space and an increased air exchange rate per hour. Face masks are also extremely important with any airborne virus, but particularly if Omicron is shown to be more transmissible, to have greater immune escape. It's more important than ever that everybody, including children from the ages of 2 and up, potentially, depending upon how well that child has been taught and how much practice they've had putting on face masks, to wear as well-fitted face mask as possible so that you minimise the chance of either emitting the SARS-CoV-2 viral particles into the air or breathing them in as well. And in healthcare settings, this is where fit-tested N95 respirators are particularly important. For further advice, please see the OzSAGE.org website under media releases, where we've listed a 2-page updated advice document, particularly about Omicron. And in that document, we link to our previous advice regarding advice during the holiday seasons and how to make sure that Christmas is hopefully lockdown free for all of us, community mask use, safe indoor air and ventilation, and finally protecting children from COVID-19 in schools and early childcare settings.
Thank you, Ben. Happy to take any questions. I guess I will ask one. There's a lot of talk about patterns of disease virulence in South Africa, and people are saying that it's milder. I mean, what are your thoughts on that? What's your synthesis of the evidence, Ben?
So it was very clear in the UK's assessment that it's too early, unfortunately, to determine the severity of disease. And so we have a suggestion that Omicron cases are going to rise really quickly. And even if it is a mild disease, that should be concerning for us, because in the case that a virus is more transmissible or demonstrating greater immune escape, the total case numbers will rise significantly higher than we're currently seeing with Delta. And that's a problem, because even if it's a more mild form of disease, which we don't know yet, a small number of those people, even if it were a milder disease, would still require hospitalisation, particularly noting what I said earlier about 1/4 of Australians not even having 2 doses of a vaccine. We have a very finely balanced healthcare system, and so even small increases in demand, an extra 10 cases a day turning up to a local hospital emergency department makes a huge difference in terms of the ability of that hospital to care not only for those existing 10 or those additional 10 persons, but all of the existing patients who are presenting or admitted. So given how delicate the situation already is and how stretched we've been during Delta and the incredible demands on healthcare workers over the past almost 2 years now from the pandemic, it's imperative that we don't lull ourselves into a false sense of security and hope and wish and pray that Omicron is mild and not do anything differently as a consequence. This is actually a reminder for us of all of the things we've been saying for a while now, and that's imperative to protect ourselves and our families and our communities from the airborne spread of SARS-CoV-2, no matter which variant of concern we're talking about.
I think those are great points. Even a smaller percentage, if it's a big number, it's still a very, very big number. So that's really important for people to consider. This isn't going to become the common cold. So even if it is a little bit milder, it can still have a massive impact. Can you talk about the OzSAGE recommendation for the timing of the third dose? Is 5 months adequate? Is that going to be enough, or should it be sooner?
So a lot of the data here is preliminary, but what we're seeing so far is that third doses both address the problem that we've already seen with waning immunity against Delta and other strains, and also it appears to be more protective against transmission of the Omicron variant. We don't yet have data to tell us whether or not a third dose is necessary in order to prevent severe disease, which would include hospitalization or ICU admission, but it's important to remember that transmission or even mild disease can be very harmful things. It can be extremely disruptive to people's lives, and mild disease may also linger or turn into long COVID. So as a consequence of these things, it's imperative that boosters are administered as soon as practicable. And in Australia, the current advice is to do that from a minimum of 5 months since the second dose. However, the United Kingdom is an example of a jurisdiction that's looked at the threat of Omicron and determined that it would be more prudent to issue a booster from as little as 3 months. OzSAGE's opinion is that we should be acting even faster than we're currently doing. So it's great that the Australian government has reduced the time from 6 to 5 months, but they should go further and make it available from as early as 2 months after the second dose. As we get more information over the coming weeks, we'll be able to firm up the strength of that recommendation. But certainly if anyone's anywhere near 5 months at the moment, you really should be going and taking advantage of the opportunities to get a booster so that you and your families are better protected over this coming Christmas period.
What effect has Omicron had overseas on hospitalization rates, and what potential impact might it have on health systems here in Australia?
Nancy, I'm not sure whether you or someone else would like to comment about the specific hospitalisation rates overseas, but the second part of that question throws back to what we were discussing earlier, that because the Australian healthcare system is already struggling with current levels of demand and has a backlog, particularly of things like elective surgery from all of the lockdowns over the past almost 2 years now of the pandemic, we really don't have much space for additional hospitalizations. If anything, people have been really hoping that we would be able to have a bit of a breather and get on top of Delta transmission. And don't forget, there's a whole bunch of states now that are just opening up their borders and about to see a significantly greater number of COVID cases than they have had previously. So there really isn't much space for even a small number. And as Omicron is likely to show this growth advantage in Australia, just as it has in the United Kingdom and other jurisdictions, those big increases in case numbers, even if only a very small proportion require treatment in hospital, threaten to overwhelm the healthcare system, which is why taking a more precautionary approach and going hard and fast now with measures like boosters is the most prudent course of action.
Yeah, I think we're starting to see increases in hospitalization in South Africa. And remember, with previous waves, there was that gap between when you had the peak for cases and the peak for hospitalization. So, you know, this is a story that's playing out. It's not a story that's been told. We also are seeing hospitalization in the UK with Omicron. And, you know, it was reported today that there has been a hospitalization of an Omicron patient now in Australia. So early days. And again, as Ben said, the vaccines may well still be protective against serious disease and death. We think they are, even if they don't give a lot of protection against transmission. So early days, but it does seem that hospitalizations are starting to increase across the world with Omicron. One of the important things I think to note also is that we're very concerned about Omicron, but I think we also need to be concerned about the virus we know a lot about, which is Delta, because Delta numbers certainly aren't coming down in Victoria. They've remained quite high, and we continue to have, currently over 1,000 cases every day, with it, continuing to stay stable, but be very high numbers. And in New South Wales, we've recently started to see cases increasing, with cases higher than they've been in a few months, actually, in New South Wales. So this is obviously concerning. Ben, do you have advice for people over the Christmas season about how to try to protect themselves? What would be the top 3 things that you would recommend people do to protect themselves?
Well, your chance of getting exposed is a product of how much opportunity you've had by virtue of time or concentration of viral particles. And so the ways to manage that are either reducing the amount of time you spend in places where you might be exposed to the virus, or spending less time in places where viral particles are more concentrated. So one of the ways to do that would obviously be to do as much as you can outdoors, host your Christmas gatherings outdoors. If you go to the pub, go to the beer garden rather than having a drink inside near the bar. That means that the air you're breathing in has a much lower concentration of viral particles. So your chance of being exposed and inhaling enough of the virus to get COVID-19 disease is reduced. You can also look at pre-event testing. So in some states, you're able to access rapid antigen tests, which are available for people who have no symptoms of COVID-19 disease. Obviously, if you have symptoms, you should go and get a PCR test from a testing site, because that'll give you the best quality result. But let's say we're going to have a Christmas lunch tomorrow. If everybody got a rapid antigen test the afternoon before, then hopefully they'll return a negative result. But if anyone gets a positive result, then that gives you an opportunity to go and get a PCR test from an official testing site and potentially avoid turning Christmas Day into a super spreading event. And the third thing is, as I mentioned earlier, the importance of boosters. And for those who aren't even up to their second vaccination yet, get that dose that you're due. So even if you've got a booster that's sort of due around the 22nd, 23rd of December, please don't put it off and wait and think, oh, I'll just do it after Christmas. The sooner you get it, the better. Most of the data on vaccine effectiveness provides for a period of at least 7, sometimes 14 days from the dose until you actually see the full benefit. So as soon as you can, getting your second dose or your third dose booster, if you're at least 5 months since the second dose, you should go and get that, because that's going to be another thing that will help not just protect you, but also all the loved ones that you're congregating with over the Christmas season.
Yeah, I think that's important. We tend to go to our work Christmas parties and be amongst people, similar age. And then we'll be socializing at home with loved ones that might be elderly over the Christmas holiday. And the last thing we want to do is to bring COVID from our work parties or socializations to our loved ones who may be at considerable risk of serious illness, even if they're vaccinated. So I think that those are great words of advice. So one of the questions here, which is an interesting one, do you think that the case is increasing in New South Wales? Do you think that that's because of Omicron, or is that because it's starting to catch, the loosening of restrictions and the mingling with Christmas is starting to catch up with us?
I'm not sure how many of the cases have been sequenced yet, Nancy. I don't know if you're aware, but certainly the number of Omicron cases is slowly increasing, but as the number that's been reported publicly, it seems to be a fairly small proportion so far. I think what we perhaps are reminded of here is the importance of continuing sequencing, and that means making sure that you know what strain of SARS-CoV-2 people are getting infected with, and then sharing that data internationally. One of the positives perhaps out of the emergence of Omicron was that the South African authorities were reasonably quick in identifying it and sharing that information with the rest of the world.
Yeah, I think certainly one of the things you can say about our COVID response in Australia has been world-class rates of testing and also very high levels of sequencing. Plus two, with Omicron, you do have the dropout. You can identify it with the most common type of Omicron. You can identify it on typical usual PCR testing. Although I think it remains to be seen, I do not think that the recent increase is solely due to Omicron. I think it's also due to the increased mixing and mingling and the loosening of restrictions as well.
Yeah, and I think the other thing to be really wary of is the daily positivity rate, so the proportion of all tests that are returning positive. And unfortunately in New South Wales, that's creeping slowly upwards as the case numbers are going up. So that would suggest that the trajectory is certainly heading towards more and more cases, which means increased risk of exposure each time you go out of the house and mingle with other people, particularly in indoor environments. So please keep wearing your well-fitted masks, even if the government doesn't mandate them.
Yeah, because I think now we have a series of factors converging on each other, which make the future difficult to predict, but really there is substantial risk of having both an increase in Delta at a time where we're mixing and mingling more, and then the emergence of Omicron. So I definitely will be wearing my masks no matter in indoor settings, no matter what anyone tells me. Very good. Well, that seems to be all the questions in the chat. So I want to thank everyone very much for attending today. I greatly want to thank the folks that organize these sessions and have been helping us run them this year. They've been done extremely professionally, and we really owe a debt of gratitude. This will be the last OzSAGE presentation webinar for the current year, but we will be resuming next year. So I want to wish you and all of yours a happy and safe holiday with clean, safe air in indoor spaces. And I hope you have as much time outdoors as you possibly can. And with that, I hope to see you in 2022.